I love the people. It's chaotic.
From this small office just off Route 1 in Falmouth, decorated with Haitian artwork, Perry Newman coordinates support for a community more than 1,600 miles away, Cap Haitian, the country's second largest city. He tries to visit 4 times a year and returned from his most recent trip in June.
This time around, it was more crowded. This time around, things were more expensive. This time around, there was a heightened sense of concern. I will say that through it all, the Haitians are remarkably resilient.
Since 2001, Konbit Sante has worked in partnership with officials in Haiti to improve health care. They have year-round staff in Cap Haitian supporting hospital and clinic leadership teams.
We work with 4 partner hospitals and clinics to advance Haitian solutions for Haitian healthcare challenges. And sometimes that means equipping a hospital, sometimes that means providing training for medical professionals, sometimes that means working with hospital administrators to improve systems.
Their work met a roadblock last year with the dismantling of USAID, cutting off an annual funding stream of roughly $180,000, which he says helped pay for community health workers, birth attendants, vaccines, and healthcare tools.
When that funding was cut, people came to work on Monday, patients came on Monday, everything was fine. On a Tuesday, all gone. So we had to scramble, and we've been very fortunate with the help of some partners and some funders to restore about 65% of that prior level of service, but more is the work that needs to be done.
In March, Secretary of State Marco Rubio said in his statement, USAID strayed from its original mission long ago. As a result, the gains were too few and the costs were too high. Thanks to President Trump, this misguided and fiscally irresponsible era is now over. Konbit Sante is also warning about the possible end of temporary protected status for Haitians in the United States, including hundreds in Maine. A Supreme Court ruling in June cleared the way for the administration to move forward with plans to end TPS for people from countries including Haiti. Borders' Tom Homan applauded the decision, arguing temporary means just that.
Temporarily give people protection while the country's in turmoil or after they suffer a hurricane.
Back in 2010, a devastating earthquake prompted the initial TPS designation for Haitian migrants. Newman argues the country is no more safe today.
So on a humanitarian level, it's just wrong to send people back to a place that is extremely dangerous. It's so dangerous, in fact, that the U.S. government has advised Americans not just not to travel to Haiti, but if they must travel to Haiti, to leave their dental records and medical records with their health care providers as well as their families. So it's almost as if you're being warned not to go to a war situation where your body could conceivably need identification. But that's perfectly okay, apparently, if you're a Haitian and can be sent back there.
In a statement to ABC News earlier this summer, the Department of Homeland Security's General Counsel celebrated the ruling, saying in part, the T in TPS stands for temporary, yet many of these designations became de facto amnesty. This is a win for the rule of law and common sense.